Thank you for joining this live town hall, COVID-19 and older adults. My name is Erica, and I'll be your host this morning. We'll be taking as many of your questions as we can on this live event. If you have a question, you can press *3 on your phone keypad at any time, and you'll be placed in line to speak with a member of our staff. They'll take down your name and where you're calling from, and the next time you hear your name, you'll be live on the call, and you'll be able to ask your question directly. Or if you're watching online, you can send your question through the website. We would like to first set the stage for this morning's discussion. Douglas County began a phased-in reopening of its economy beginning April 27th, consistent with Governor Polis's statewide safer-at-home orders that began that day. Since that day, Douglas County has been working with many older adult service providers, your Tri-County Health Department, as well as community leaders, ensuring that we all address the specific and unique needs of older adults in Douglas County during this time. Joining us today are your county commissioners, Karie Erickson from Aging Resources of Douglas County and Dr. Douglas of the Tri-County Health Department. During the next hour, we'll take your questions and provide you with updates on the impacts of COVID-19 on older adults. And speaking of being safe, Douglas County encourages everyone to continue demonstrating the public health recommendations found in the state orders, including following social distancing guidelines, frequent hand washing, and especially if you are over the age of 65 or you have chronic health issues, staying at home as much as possible to avoid possible exposure to COVID-19. Your Douglas County Commissioners, Roger Partridge, Laura Thomas, and Abe Layden are joining us live via video, while Dr. John Douglas and Karie Erickson will join us on the phone. You can also watch and listen at douglas.co.us/townhall. If you're just joining us, to ask the question, again, you can press *3 on your phone or send your question through the website. Let's get started with a welcome from your county commissioner. Commissioner Partridge, please start us off.
Thank you, Erica, and welcome to everyone. Thank you for joining us this morning. We are excited to be able to speak with you today and present to you. We hope we'll be able to answer all your questions and provide you information if you are unaware of anything. We certainly want to be there for you. And over the past 4 weeks, we have certainly heard from some of our most vibrant and energetic members, that is you, about the unique needs of you. So we hope we can be there today for you, and we decided to dedicate this town hall to older Americans, or like I like to say, the most vibrant and energetic group in our community. Thank you, Erica. Be able to speak with you today and present to you.
Wonderful, thank you. And now let's go to Commissioner Thomas.
And provide you information if you are unaware.
All right, let's go ahead and go to Commissioner Layden. Commissioner Layden, can you hear us?
Yes, I can. I can hear you. Hello?
All right, go ahead.
Yes. Hi, Erica. Thank you. And what a wonderful opportunity to be with the greatest generation this morning. We really wanted to set aside some time to connect with seniors in and around Douglas County that certainly have been through a lot in recent months, but we know you have been through so much more. You know, I had an elderly grandmother that finally passed at 102, and she saw the 1918 Spanish flu, saw World War I, World War II, the Vietnam War, the Korean War, and certainly 9/11, Vietnam, everything else that followed after that. So I think for many of you, this is something that you're dealing with well and proudly, and so we certainly appreciate that. I also have an elderly mother. She is 66 years young and wonderful. I love her dearly, and she is in Douglas County. And she also has an underlying respiratory condition. And so I'm really pleased that as a free citizen, she has made that decision to say, you know what, we realize the economy is important, but for her, she wants to stay home and keep her health a priority. And so we respect the decisions of free people to do what makes best for their health and their personal circumstances. So, Mom, if you're out there, I love you very much, and looking forward to hearing from our valuable seniors today.
Wonderful. Thank you so much, Commissioner Layden. And I'm just wondering if we can hear from Commissioner Thomas. Commissioner Thomas, can you hear us?
Can you hear me?
Yes, now we can. Hi, go ahead.
Okay, great. Thank you. I was saying thank you to the greatest generation who has taught us so much and really did so much to preserve our freedoms. And if it weren't for those people, that generation that saved America and the world, we wouldn't even be here today. So we owe you so much. My mom also is listening. She's 87. I would consider her elderly. But you know what? She doesn't act elderly. We have seen amazing resilience from Mom. So we're looking forward to hearing your questions and to see if there's things that we can do to help you get through this challenging time. Thank you.
Wonderful, thank you. And let's go ahead and go to our live callers. By the way, if you would like to ask a question on this call live, press *3 on your telephone keypad and we'll get you in the queue and hopefully answer your question. All right, our first live question is Nick in Parker. And this question is for Dr. Douglas. Nick, go ahead.
Thank you so much. Thanks for taking my call. My question is more a social one, and so I'm not sure what advice you'll have, but in general, do you have any social advice or guidance for family members or family units that are having differing opinions on what's the most appropriate in terms of visiting, social distancing, remaining safer in home versus having some distance among family members, and how to sort of reconcile the strife that can occur when one group within a family may feel like it's safe to have some visits and another group might feel like they want to maintain stricter guidelines in terms of distancing. Thank you so much.
Nick, thanks for that question. I think it's a particularly important one as we begin to open up more. And, you know, as the commissioners talked about, they've got parents who are choosing to, kind of hunker down and stay at home, which is what the governor advises. But then your question comes up, which is, gee, can we go see them? How do we go see them? What if me and my sister have a difference of opinion, this sort of thing? I think as much as possible, if families can sort of look at the parameters of the science. I mean, that's sort of a cliche for a doctor to say, but and try to honestly reflect on what the issues are. For example, if I don't have a grandmother or a parent alive anymore, but if I were to want to visit them, I would probably do so in an outdoor setting, and I would probably do so wearing a face mask. And I would do so in a setting where we could all wash our hands quite frequently. And I would really avoid the understandable tendency to want to give them a hug. And if I had kids who wanted to give their grandparent a hug, I would really do my best to sort of keep them apart from the grandparent. I guess the other thing I would acknowledge is it's probably important to honestly say different people can have different opinions. Even if you look at the same science, you might come to a different conclusion than I would. So trying to understand, the rationale for different recommendations and honoring each other's opinions with the idea that ultimately you want to keep your loved one physically, but also emotionally as safe as possible.
Wonderful. Thank you, Dr. Douglas. Next, we have Andrea from Elizabeth, who also has a question for you, Doctor. Andrea, go ahead and ask your question live.
I'm a senior. I'm 70, and I also have underlying health issues. Historically, up to this virus, I've worked for a living to put money in the bank to pay for food on the table. With this COVID, that's, of course, been an issue because there's been no money coming in. Now, in terms of going back to work, my job site is going to open mid-month, and I'm trying to figure out whether I can safely go back to work, which is so important money-wise. Do I have any other options in terms of financial help to delay going back to work? And then if I do and lose my job, is there anything that they have done for older people to help them get through this? Because the place where I'm working is a small business and they aren't going to have plastic barriers or anything like that. The only thing I'll have is a mask, and that doesn't protect me. It protects other people, but it doesn't protect me.
Mm-hmm. So, Andrea, this is a really important question that many folks are asking. I'm going to say a few things, and then I'm going to see if Karie might be able to address that. She might have a little more expertise than I would. I think your concerns are legitimate. You're absolutely correct about face coverings or masks. They're more protective of you to others than they are of others to you. The governor's public health order does allow individuals who are vulnerable, and certainly somebody who's 70 or somebody who's got an underlying health issue, heart, lung disease, diabetes, is not required to go back to work. So you do have some protections in that regard. But I think that many folks who've been in the workforce, whether they're 70 or frankly they're 40 and they have diabetes, will have the same questions as you do. And I think there are legitimate questions to be asking your employer about how they can, what steps can be taken in that workplace to help best protect you. But Karie may have some more specific advice if I could ask her to weigh in.
I'm happy to. You know, a lot of people are struggling with finding resources during this time, and I would really encourage you to give our office a call because we're working with other nonprofits to deliver groceries and household goods to folks that are struggling during this time, and it's at no charge to you. So you had mentioned you were working to put food on the table and household expenses. Give our agency a call and we will put you on the route to receive some groceries. And the number that you can call and others can for food and grocery help is 303-814-4300. And we can talk specifically about other financial resources when you call.
Wonderful. Thank you, Karie. Let's go to our next live question. This is Lauren in Roxborough Park. And this is for Dr. Douglas as well. Lauren, go ahead. You're live. You can ask your question.
Good morning. I'd like to ask the question as to whether it's safe to keep doctor appointments when you have an underlying respiratory condition.
Lauren, thank you for asking that question. It sort of should be one of our automatic talking points. The answer is a resounding yes. And it's a resounding yes because there's been confusion about that, frankly, over the last couple of months. The message was hunker down and stay home. If you don't have COVID, don't go to the hospital. The hospital might be a risky place, or even your doctor's office. There might be other people there with COVID. It turns out that that's not the case. All of our healthcare facilities have done a fantastic job of organizing the logistics and having the providers supplied sufficient personal protective equipment. So fortunately, they're protected, and they're being protected means that you're being protected. And frankly, many of us in public health are worried about folks who haven't been seeking routine health care for chronic medical conditions out of concern that those problems may be exacerbated. So rest assured, if you've got a condition that needs medical attention, that you can safely seek that attention.
Great. Thank you, Doctor. And we have another question for you from Margie. Margie's in Lone Tree. Go ahead and ask your question live, Margie.
Hello, Dr. Douglas. I have two questions. The first is, I'm 65 and in very good health. Will it be safe to go to a meeting of 100 people in a conference room in September? I'm supposed to be the presenter, and I'm not real comfortable with that. And I kind of want to go with maybe the remote, do it via like WebEx. but I just wanted to get your opinion. Do you think in September, seeing that there probably won't be a vaccine by then, will it be safe, or should I do the presentation remotely? That's my first question. The second question is, I walk the bluff every day. I walk 3 to 5 miles, and of course, no one is wearing face coverings, or there might be very few. But is it really necessary? There are times that I come across people that take up the entire path, the width of the path, and they don't move over into single file, but it's just such a short time that I'm passing them, and wondering if that's still safe to be out there without a face covering. Those are my questions. Thank you.
Thanks, Margie. Those are really good questions. First of all, I don't have a crystal ball for September. What I will say is that right now we're at a pretty low rate of infection in Douglas County and Colorado. And yet even now, I would say if you're supposed to go to a conference of 100 people, I would do it remotely. In September, it's likely, we're hoping schools are going to start. We honestly think that school starting could result in some increased transmission. So I don't think it's going to be any better in September. You're correct. We almost certainly are not going to have a vaccine. So you could, depending on the conference organizers' patience, sort of play it out and see how it looks in September. But I'd be astounded if it was safer than it is now. And if I was you, I would do a presentation today remotely. Regarding your question about walking, great. Keep up the exercise. That's fantastic. You know, I would say that we've been working hard on trying to promote the use of face coverings. As it was pointed out by Andrea earlier, this is really a gesture that someone is taking to help other people, not just to help themselves. And so we really do want to have people kind of get the message that this is a great thing you can do to serve your community, show personal responsibility, and help others. Having said that, I think your risk of passing somebody on the sidewalk, even if they're not really giving way and keeping to their side of the sidewalk, is actually pretty low. If it was me, and when I walk around my neighborhood, I do wear a mask. Partly it's because I'm a public health official and I want to model that behavior. But, you know, I would also like to protect others and protect myself. So I think risk is low, but I think mask wearing could be of some benefit to you, even in that circumstance.
Great. Thank you, Dr. Douglas. We have an online question from WGW, and this one's for you, Doctor, as well. And they're asking, when is it anticipated that the stay-at-home order will be lifted for those that are 75 years of age or older?
So this is a really important question. Right now, people 75 and older are not really ordered to stay at home. They're simply strongly advised to stay at home. And they're strongly advised to stay at home, really honestly, to protect their health and well-being. My guess is that we're going to continue to be providing that sort of general cautionary information. We want you to be able to live your life, connect with others, get out like Margie's doing, and get regular exercise outdoors. The summer is a fantastic time to do that. But it's hard for me to see, honestly, short of a vaccine, that we're going to be able to say to our older adult residents and those with chronic disease, you're good to go now. You don't have to worry about it anymore. Just like you would probably, I assume you might take precautions during flu season. And right now we've got the equivalent of a bad form of flu going around for the foreseeable future. So try to think about those circumstances that are really important to you. Try to take the precautions. But I think those of us who are in that older age group are going to need to sort of think about how to protect ourselves for the foreseeable future.
Thank you, Doctor. And thank you, everyone, for all of your valuable questions. Thank you, Dr. Douglas and Ms. Erickson, for this much-needed information. What's on your mind? We want to hear from you. To ask your question, you can press *3 on your phone, or if you're watching online, you can send your question through the website at douglas.co.us/townhall. All right, let's go to our next live question. We have Cindy in Franktown, and she has a question for Karie Erickson first, and then Dr. Douglas, if you want to add to that as well. Cindy, go ahead.
Okay. Assuming everybody can hear me okay.
We sure can. Go ahead.
Thank you for these calls. Thank you for these calls, by the way. I try to call in every time possible, and I appreciate that you also record them for later. My question is, as places start to open more establishments, I'm specifically asking about hair salons. What guidelines do they need to follow in Douglas County?
Hi, Cindy. Thanks for your question. We have been getting a lot of phone calls about hair salons. Now, while I can't speak specifically to the guidelines, I do know that each of the hair salons are required that both the hairdresser and the patron wear a mask. You can't stay 6 feet apart when you're getting your hair done, so I know there's a lot of nervous feeling about that, but I am under the impression that they can only have 50% of their clientele and staff in the hair salon at one time, and I do believe they are having patrons wait outside until their appointment time. And I always go back to what Dr. Douglas is saying and what is recommended. If you can, really minimize your exposure. But if you need to go, make sure you're wearing your mask.
And Dr. Douglas, would you like to add to that?
Yeah, I think Karie covered it really quite well. I guess the only things I would add to that nice summary is these salons should be providing services by appointments, which means you should have to be doing less of this waiting. You should be asked, are you okay? Do you have any symptoms? We don't want you coming in if you have a cough or a fever. That's, of course, to protect the staff there, but also to protect other people who may be in the salon. The salons are strongly encouraged to do payment options that don't involve touching, contactless payment options through credit cards and this sort of thing. In that communal gathering spaces, waiting rooms really ought to be kept to a minimum to try to avoid contact. That's what the appointment thing is all about. And as Karie said, the face covering really is important there. I've got a beard, so I couldn't get it trimmed because I'd have to leave my face covering when I was getting a haircut.
All right, thank you, Doctor, and thank you, Karie. Our next question is an online question from Tom Carlson, and I'll have you, Dr. Douglas, and Karie weigh in again on this. What can assisted living, not skilled nursing or memory care, communities begin to have social distancing meals and activities, and when can families start to visit?
I'll start, but Karie may have some contributory thoughts given her expertise in the area. Tom, this is a really important question because, frankly, the loneliness of being in various settings like assisted living can really take an emotional and even a health toll. Right now, there is no defined time frame for when that congregate meal and visiting is going to be able to happen. I think it'll depend upon what's happening with community transmission and how good the infection control practices are inside the facility. For those of you who do have family in that setting, I'm sorry we don't have greater clarity, but honestly, we've had so much problems with outbreaks in these facilities that I think we're going to really have to take this one particularly slowly.
I would agree with Dr. Douglas on this. Tom, we have gotten so many calls, and it is really difficult for families to not go into these assisted livings right now, and yet I feel that the risk is so high that we have to continue to really be cautious. I would encourage you to find out if there's video chatting available. Some assisted livings do have that. Staff is helping with iPhone, FaceTime, and some other types of video chatting. And with summer coming, it could be that maybe there'll be some outdoor opportunities to get together in the courtyard. So check with your assisted living facility on that.
Great, thank you. Let's go to our next online question. Elaine wants to know, she wants to ask Dr. Douglas, I would like to visit my 85-year-old sister in Grand Junction. I am 72 years old. I'm healthy. What is the risk of going to stay with her overnight for a visit, and what is your recommendation?
So this is, again, as the summer comes and as our communities get more opened up, this is going to be an increasingly important and common question. Elaine, I would say it like so many things with COVID, it all depends. And it all depends on how socially distanced you've been able to be. What's the chance you could have acquired infection and could transmit it to your sister? And then vice versa, what's the chance that she could have been infected and transmitted to you? If you've both been, pretty careful, laying low, not having any substantial contact with other people, I think you could cautiously proceed. When you do visit her, I would encourage you guys both to be wearing face coverings. That's sort of a hassle. She's your sister. That seems weird, but that's an added protection. The more that you can be with her in well-ventilated spaces, do as much of your visiting on the patio or the porch if she has one. Keeping windows open, that's probably better than air conditioning. Probably avoiding the understandable desire to hug each other. Again, trying to keep that 6-foot distancing. It really is frustrating to have to exercise that with a loved one, but I think you'd rather be able to safely be in her presence and have both of you continue to be healthy than to run the risk of infection being transmitted from either one of you to the other.
Thank you, Doctor. And a reminder again, if you're just now joining us and you want to ask a question, you can press *3 on your phone and you can get live into the queue, or you can send us your question through the website. Let's go to our next live caller. We have Sandy in Parker. For you, Dr. Douglas. Sandy, go ahead and ask your question.
I actually have a few questions. The first one is really simple, I guess. So do dogs carry the virus in their hair? I have a neighbor who has a dog, and we live in an apartment complex, so I walk my dog, and if she's walking, she comes close, and I keep backing up with my dog. And so I don't know what I should do. So should I tell her, well, we shouldn't have our dogs close? I had heard that dogs can carry the virus also.
Yeah. Let me try a shot at that. There has been, as far as I know, one reported case of a dog that had COVID, but it seems to be an extraordinarily rare circumstance. So I think the question of whether your neighbor's dog could have COVID, and if you pet it, you could catch it, is probably pretty low. There is a possibility that if your neighbor or your neighbor's kid had COVID and coughed on the dog, and the dog walked by you 15 minutes later, we do know that, or do believe rather, that inanimate surfaces could transmit infection. The more we learn about the COVID, the less important we think that is. So I think as long as you're staying 6 feet away from the neighbor, I wouldn't be so worried about your dog brushing up against the other dog, or even you, especially if after you take your walk, you do good personal hygiene, you wash your hands, which, by the way, I haven't mentioned enough during this town hall, but that's sort of like one of the 3 or 4 top commandments of COVID prevention is frequent hand washing.
Wonderful, thank you. And we are going to go to a poll next, and you can vote on your telephone keypad. The question is, have you participated on previous Douglas County live town hall events before? Press 1 for no, this is my very first time. Press 2 for yes, I've participated on one or multiple previously. Or a couple previously. And 3, I have participated on several. So again, that's 1 for your first time. Second, for 1 or a couple previously. That's 2. And then press 3 if you have participated on several events. All right, let's go to, I see all those votes coming in. Thank you so much. Let's go to Shannon. She is our live caller in Highlands Ranch. Shannon, you are live. Go ahead and ask your question.
Thank you. I am not elderly. I have parents that are more elderly, and I'm calling kind of to get some advice on how to deal with the fear that in particular one of them has, that one, I can't be over there to see them without feeling like I'm putting them in a bad position. And two, as I resume more normal activities in my life, I know they're terrified for me. At least one of them is. And I feel really frustrated that from a distance, I have absolutely no idea how to help one of my parents deal with this fear. And I also kind of worry that it's causing some irrational behaviors. I mean, the level of fear I see seems to not match up with the reality of what's going on. And it alarms me.
Thank you, Shannon. And that question is for Karie Erickson and Dr. Douglas, if you'd like to add to that as well.
Hi,
yeah,
Shannon.
for anybody.
Okay. Hi, Shannon. This is Karie. It is a scary time. It really is. And I think if you feel as though your parents are having irrational fears, I think a lot of people might be having more fears than normal. Dr. Douglas is the expert with the medical side of this, but I would absolutely encourage you to either yourself or have your parents give me a call or give Aging Resources a call, and we can talk about different strategies. We can talk about different resources that are out there. There are a lot of different mental health options available, and it might even be nice just for them to have a phone companion to talk to so that they're not projecting everything onto you, especially when you're going back to work. So again, have either yourself or your parents, if they're willing, call Aging Resources, and we can pick this up additionally one-on-one. And that phone number, again, is 303-814-4300.
I think that's really sound advice from Karie. The only thing I would add to that is this really is a tough balancing act between having all of us take the epidemic seriously and not have an overreaction. I do think the summer, where right now our rates appear to be dropping and we can be outside, is a particularly good time to, try to be together with some social distancing and to try to emphasize that things are, we have to be vigilant, but things are improving. And as long as we're vigilant and are prepared to be more cautious when they get worse again, I think we can all work together, whether we're young or old, and make our way through this epidemic.
Wonderful. Thank you, Karie and Dr. Douglas. Next, let's go to an online question. We have Kathy. She would like to ask Dr. Douglas, our parish has begun having Mass in person again. They are following the rules set forth by the Denver Archdiocese. We are trying to make a decision about returning to Mass in the church. We are 65 years old, and my father-in-law is 88. What are your thoughts on that?
It's a really important question. It's a common one for those that are part of faith communities. I don't know exactly what the Archdiocese's language is. I will say that Douglas County's requested a variance for faith-based houses of worship to be able to meet, and they strongly discourage folks that are 65 and older from attending, frankly, because of, as we're just beginning to get off the ground here with restoring this essential part of our community life, we're trying to be as careful as possible. I think if I was you, I'd sort of wait and watch and see how the setting with the Mass observances proceed. Do they seem to, talking to your priest or other representatives of the church, maintain pretty good social distancing? If so, as we begin to get more comfortable with that, I think it might make sense for you to be able to attend with all the provisos, 6 feet, hand washing, face coverings, I'd probably move much more slowly with somebody in their 80s because their risk is so much greater. That's not to say no, never, but it is to say I think I'd probably hold off a little bit and sort of see how the return to our churches process actually goes.
All right, our next caller is Bill. He is live from Castle Rock and has a question for Dr. Douglas. Bill, go ahead.
Yes. How long after someone who has had the COVID-19 virus should they be symptom-free before it is safe to be around them or in their home?
Bill, that's an important question. And as we, by the way, are doing more testing, which fortunately we are doing, we will identify more people with COVID, and that question will come up more frequently. The general rule of thumb has been that once someone's symptoms have been gone or have resolved entirely without any medication support, for example, you're not taking a drug that might suppress a fever, and it's been at least 7 days since the onset of the illness, you should be safe in terms of contagion to others. Now, if you're in a vulnerable category group, and vulnerable, we're talking about people that are over the age of 60 or 65 and or have chronic underlying disease, we don't have specific guidance about that, but I think it would be wise to give it a little longer period of time, at least to be around them in person. And by a little longer period of time, I'm thinking 5 to 7 days or so, because those parameters I mentioned earlier are kind of statistical parameters. And if you're a person who's at greater risk of getting infected, I think you ought to, greater risk, of having a worse complication, I think I'd take it a little more slowly.
Wonderful. Next, let's go to another live caller. We have Eric in Parker. Dr. Douglas, for you, but also Karie, if you'd like to weigh in on this. Eric, go ahead and ask your question live.
Thank you for taking my call. My wife and I are grandparents. I'm 67. She is 63. She primarily takes care of our daughter's kids because her and her husband are both working. We are both very healthy. I do not see them very often. She goes to their house, takes care of them, and then comes home. We take every precaution we can. We do our social distancing when we go walking. My question is, are we a danger to them, or are they more of a danger to us? And is this something we should cease, or is this something that we should be able to work with, since this is where our life has brought us to? Thank you.
So that is for any grandparent, I think, a really important question. Honestly, I think the way you all are handling it sounds pretty appropriate. As an aside, I'm in the same circumstance. I've got grandkids, and my wife takes care of them, and we're sort of trying to figure this out. I will say a couple of things. You've mentioned the precaution, social distancing. I think that's really important. I'm going to sound like a broken record, but I really do want to emphasize the hand washing and the face coverings as part of your bag of tricks to try to prevent transmission. The final thing I would note is that this in part depends on how much contact you and your wife have in other circles. Are you being pretty sequestered, or are you actually getting out a whole lot? And even more importantly, vice versa, your daughter and her kids, are they part of broader settings? And I only mention that because the broadness of their settings honestly has some potential for increasing their risk of exposure. And I would be a little more cautious if they're in, play groups and hanging around with a ton of other kids. Sounds like they're not in a daycare center because your wife is taking care of them. So I'm assuming that's probably not the case, but that would be a parameter to consider. And then finally, you ask about directionality of risk. Clearly, you're at greater risk of having a problem transmitted from them than vice versa. If you got sick, you could certainly transmit to them. And there is a newly recognized syndrome of quite severe illness in kids that could be, a problem for them, but it's a whole lot less common than the kind of pneumonia syndrome that an adult could develop. So you want to take care of each other, but clearly the risk is more for you catching it than your grandkids catching it.
Thank you for asking that question, Eric. And I always say whatever Dr. Douglas says is what we follow, but it's interesting. Dr. Douglas was just talking about, well, how many other people are you or the parents in contact with? And what we've been hearing from a lot of our grandparents is that they're forming what they're calling bubbles. And so within the bubbles, they are limiting the amount of people that everybody included in the bubble is having contact with. So if you're able to limit, it's just going to be you and your adult children and your grandkids, and maybe the people that your adult children have to come in contact with at work. That would be the bubble. And if everybody can adhere to staying within that bubble, as Dr. Douglas said, you're kind of you're limiting your exposure, if you will, by limiting outside contact. So I think that's a good idea.
Wonderful, thank you. And our next question is an online question for you, Karie, from Sue. She says, socialization is very important for seniors. Would it be safe for seniors to gather if their masks are worn and social distance is maintained? Would it make a difference whether the gathering is inside or outside?
Hi, Sue. Thank you for asking that question. It is so important. And I feel like being isolated, that's got risks of its own for our health at this point. And, as Dr. Douglas has said multiple times, wear your mask, wash your hands. And I do think that if we're able to gather outside where there's fresh air and ventilation and we're staying 6 feet apart with small gatherings, I still think we have to, it's recommended no more than 10. And so if it could be smaller gatherings outside, I think that's something that we can start thinking about doing this summer, especially if we're wearing our masks and staying apart.
Great, thank you so much. And now, let's go to our next poll question. We would like to make sure that you stay informed about what's happening in Douglas County. So if you'd like to continue receiving information from the county, please press 1 on your telephone keypad now. Again, that's press 1 if you'd like to receive more information. Okay, let's go to our next question for Dr. Douglas, an online question that says, when can the senior centers reopen so I can see my friends again?
Senior centers is certainly an important part of the fabric of the community, and I think all of us would like to see them, like other settings, begin to get going again. As Karie said, we currently have got restrictions on settings where more than 10 people are gathering, which impacts senior centers. I don't think they are out of the question in the weeks to come. When they do open, they'll have to be vigilant about the kind of social distancing guidelines that we've talked about. But I think I don't have a prediction exactly when that's going to happen. I think it will depend on community transmission rates. I guess I want to largely note that they're important, but they're probably places because we've got groups of vulnerable people gathering together that we need to be particularly careful about.
Wonderful, thank you. Let's go ahead and go to a live caller. We have Nina in Ridgegate. Nina, you are live. You can go ahead and ask Dr. Douglas your question.
Thank you very much for taking our questions. Yes, my mother is at a senior living facility in an independent part of the facility that also has an assisted and a memory attached to it. My mother has been in quarantine since mid-March, and when there was an outbreak in the memory part, that became locked down, and the caretakers who were coming in to take care of my mother on a daily basis didn't quite feel comfortable in those circumstances, and I agreed with that. And I came to live with her and be with her and to be her caretaker, and also to take her to her chemo meetings or her chemo sessions at the doctor's office every week. So when I arrived on April 28th, I also became quarantined with her in the apartment room, which means we don't go outside, we can't go in the hallways, we can't go anywhere except to necessary doctor appointments, which is chemo. So I've been here now since almost a month and on quarantine, which is fine. But what happens is every time we go to the doctor's office on Monday and Tuesday for her chemo, when we come back, we're re-quarantined. So it's virtually a never-ending, continual quarantine. So I'm a little bit confused on, can that actually continue? And if so, could we be on quarantine forever? It's really a daunting situation because I'm with her and I keep her active and healthy and make her do games and breathing and exercises and yoga. But I see a lot of the other people as I leave or as I know across the hallway that it really is having a tremendous effect to have this isolation. And if we were at least able to go outside and sit in the sunshine or go outside for a few minutes every day or go in the hallway, it might be something interesting. So my question is quarantining different than self-isolation? And could you or do you anticipate that quarantining every time we go out and then come back in is going to continue?
So this is, Nina, really a complicated situation that you're asking about, and it's your concern. Are you like on a hamster wheel forever? Is a very legitimate one. I honestly think we probably need to talk offline, and what I would suggest is if you could perhaps send me a short email describing this, I can get it to one of our staff who could perhaps dig in and consult in a little more depth with you. I'm guessing what's going on is a nursing home has taken some extreme precautions because of the infection situation, and they've got this criteria set up. But what's not so clear to me is why when you go to the doctor's office, why that's deemed to be risky enough to put you back in quarantine, which is, I think, what I'm hearing you say is happening. But perhaps we could try to unravel this, even potentially talking to the facility and understanding what their criteria are. So my email, and I'll get it to the right person, is jmdouglas@tchd.org. And I can't guarantee you we can completely figure it out, but we can certainly try.
Great, thank you. Our next question is for Karie Erickson, an online question. She says, where can I turn for help with food, transportation, and housing if I don't have enough money to pay for it myself?
That's a great question, and one that a lot of people have been wondering about. There's a lot of agencies right now that are offering assistance. And I would say that depending on where you live, well, Aging Resources serves the entire Douglas County area. That is our focus area, is Douglas County. And so you can reach out to us. If you live in Castle Rock they manage the Meals on Wheels program, Castle Rock Senior Center, and they also have drive-through meal boxes that you're able to sign up and get. If you're in Parker has a hot meal program that you're able to get. But I would say if you want to make one call Aging Resources, and we can plug you into the different agencies that would be able to help you.
Great, thank you so much. Let's go ahead and take a few more questions. We do have a lot more questions coming in, but let's go ahead and go to Marilyn in Parker. Marilyn, you are live. You can go ahead and ask your question.
When I have groceries brought to me, do I need to let those set for a couple of days, or do I need to wash those down? And that's my question. Thank you.
This is Dr. Ogden. I'd be happy to take a shot at that one. It's a common question and an important one. Again, I think the notion that inanimate objects can transmit COVID is an important one, but perhaps one that we've overestimated. I think if you're talking about packaging, it's sufficient to let it sit on a counter for several hours, and any potential risk of the delivery person having COVID and touching it ought to be mitigated by that sort of situation. If you've got something that needs to be refrigerated, probably the simplest thing to do is to simply clean it off with routine household cleanser, let it dry on the counter, and put it in the fridge. If it's like a head of lettuce that's not cleanable, then I would go ahead and wash it, let it, with a cleanser, for example. I'd go ahead and wash it, let it dry out, and then put it in the fridge. I do want to say that being attentive to that is probably a smart practice, but I want to reassure you the risk of that creating a transmission scenario is actually quite low.
Wonderful. Thank you, Doctor. And by the way, we are just getting so many questions this morning that we will be adding an additional live town hall just for older adults and their caregivers to help everyone out, since there are just so many different questions coming in about this. So again, just look out for that. Another one coming up here on older adults and their caregivers. All right, before we conclude our live town hall, we'd like to give your Douglas County Commissioners a few moments for final comments. So let's go ahead and hear from Douglas County Commissioner Abe Layden. Abe, go ahead.
Well, I just have to say I have really enjoyed hearing all of these great questions, and I have to apologize for the use of the word elderly. I received a lot of text messages while I was on this call from dear friends and folks that are very active in the community that are in their 80s that said, you know what? I'm still active out there, and I'm a very energized senior, and I really appreciate that, and I agree with that. If it makes you feel any better, my wife and I, when we had our third child, when she was pregnant with our third child, they call that a geriatric pregnancy. So these silly medical terms, we got to work on those. But I just want to thank you again for those questions. I'm glad we're adding another session. I believe this is our 8th or 9th live town hall, and we're just going to continue to sit with you directly face to face, or if you're on the phone. We appreciate the opportunity to chat with you. We believe in you as seniors and as the greatest generation. We thank you for your resiliency. Stay safe and stay well out there.
Thank you, Abe. And now let's hear from Commissioner Laura Thomas.
Thank you, Erica. I'd like to thank everyone for tuning in and listening this afternoon. I know that I learned so much from my grandparents and my mom. And, we can still learn so much from you. And the commissioners have been working with our staff to get some variances done so we can get more portions of our economy going, because we want you to know that we're still going to be here for you. We're going to be taking care of our economy and our county so that when the threat is no longer there and you can be safe to come out and have lunch and dinner with us, that the economy will be vibrant and we'll be waiting for you to join us. Thank you and have a great weekend. It's supposed to have some nice weather. Thank you.
Thank you, Laura. And now let's hear from Commissioner Roger Partridge. Roger, go ahead.
Thank you, Erica, and thank you to the listening audience. Great questions and certainly very good responses. Dr. Douglas and Karie, wonderful job. I think the information you provided is so valuable, probably created some further curiosity. And again, like Dr. Commissioner Lade mentioned, another town hall for seniors is certainly a wise choice. So as you go on about your day, we certainly want you to think about your health And I always think of stress. I look at stress as not being a causative factor, but it is an aggravating factor to already underlying conditions. So do everything you can to decrease the amount of stress and strain in your body and your lifestyle. And certainly, as Commissioner Thomas mentioned, wonderful weather. I think that always lifts everybody's spirits. And even some of the rain we get is very uplifting too. So enjoy that outdoors. Get those windows open if you need to. Take care of yourself. Check in with friends, family, neighbors, and be well, be safe, and we pray for blessings for all of you. Thank you, Erica.
Thank you, Commissioner Partridge. And on behalf of Douglas County and the Tri-County Health Department, thank you for sharing your morning with us. Again, there were so many questions coming in about older adults and their caregivers that we are going to add an additional teletown hall. We'll keep you informed about when that will be coming up. There's also going to be more information about the additional variance requests that will be happening this week to further reopen counties. So we would love for you to join us again this Wednesday at 4:30 for the Your Health and Safely Reopening Our Economy weekly update. Be well, be blessed, and have a great day, everyone.